Bismillahirrahmanirrahim. I am Dr. Javed Iqbal Kokar, Professor of Forensic Medicine and Toxicology. As I am discussing personal identity, and this is the 26th lecture of this series. And from today onwards, I will be discussing very important topic, that is sex determination. And what are various parameters of sex determination? The contents of today's talk will be that I'll be talking about what are the parameters of sex determination and what are the objectives of sex determination. What are various situations where the sex determination is required. So starting with the topic sex determination, the situation may be, person may be living, subject is in front of you and you have to determine the sex when there is doubt or some suspicion arise, or the only skeleton is presented to you, some bone, some complete skeleton or parts of the bones or few bones, then you have to determine sex. Then the body, if it is presented that is putrefied or mutilated, or some body part or even remain is presented to you. The purpose is either for the civil cases like marriage, employment, age determination, so inheritance, property disputes, where the age is under question or identity is under question. Then there may be either the criminal cases. So the person presented is culprit or accused, and you have to fix the identity and find it out. Then the sex comes sometimes important. Then what are the parameters for the sex determination? General appearance of the person, or certain sex characters which are specific for the sex, genders, sex organs, nuclear sexing. So these are all the parameters from which we can confirm the gender. Gonadal biopsy, then the study of bone. If the bones are presented, the hip bone, the skull, mandible, long bones, they are important for determination of sex. Then from the teeth gives also very valuable information. For example, the male second molar have 4 cusps, whereas the female second molar do not have 4 cusps. Now, sex determination in normal cases. There are 3 types of evidences which confirm the gender of the person. Most certain evidence, highly probable evidence, and presumptive evidence. What are the most certain evidences? That is, presence of the ovaries in females and testes in males is the most certain evidence. Then highly probable evidence, in female, the development of the breast, female pattern of distribution of hair, and presence of vagina, they are highly probable evidence of female gender. And for the males, the absence of breast tissues, male pattern of distribution of hair, and the presence of penis is highly probable of male gender. Then the presumptive evidence means that the contour of the face, distribution of hair, shaving, wearing of clothes of a particular gender, male or female, these give a presumptive evidence externally that this is specific gender. So thank you very much. This was all about the first lecture.